Welcome to the New Arab's latest webinar, Vaccinating MENA Against COVID-19. Today, I have three experts who have joined us to talk about the challenges created by and related to the COVID-19 pandemic in the Middle East and North Africa, as well as what the vaccine rollout will look like in the region. My name is Narjas, and I'm a journalist for the New Arab. We are a progressive and diverse London-based news organisation covering the MENA region with a focus on democratic transition, human rights, and social and economic justice. So the MENA region has been grappling with the spread of COVID-19 for over a year now, with many recently experiencing a dramatic surge in cases which overwhelmed hospitals and highlighted issues of inequality, as well as shining a light on the inadequacy of some healthcare systems. From Syria to Lebanon to Algeria, Iran, no country remained unscathed. And with the development of multiple vaccines, the MENA faces challenges of inequality and access related specifically to vaccine distribution. Today, I am joined by Professor Fadi El-Jardali, medical Dr. Tamam Aloudat, and Dr. Yara Assi. Each of you will have 10 minutes to speak before we open up the opportunity for questions. And if you have a question you'd like to ask, please click the Q&A button below, and I will see the question and make sure that it's answered. So first, we will have Professor Fadi El-Jardali, who is a professor of health systems and policy and founded the Knowledge to Policy Centre. He is also director of the World Health Organization Collaborating Centre for Evidence-Informed Policy and Practice, and co-director of the Centre for Systematic Reviews in Health Policy and Systems Research. It's a mouthful. So I guess the first kind of couple of questions I would like you to answer, Professor Fadi, is, I guess, what is the state of healthcare systems in the MENA and how have they been challenged in the recent pandemic?
Thank you so much, and welcome everyone. And thank you for having me today in this webinar. Let me start by just briefly mentioning that the outbreak, in fact, it created a lot of challenges to public health system everywhere. And this is not only about MENA region. The first thing, we've seen that there's many systems that there's a lot of inefficiencies that exist in health system and public health. There is issue related to capacities, issues related to accessibilities, but at the same time, when it comes to the global context, we've seen also that many countries are vulnerable because of the challenges when it comes to production and the supply chain, because of the issues related to, and now what we're seeing in terms of the vaccine, there is a production capacity, how much we can satisfy global demands, including high-income countries, low-income countries, and issues about accessibility of and affordability of vaccines, for instance, for poor countries, and the issues about vaccine nationalism and how we can really try to counter that and ensure access, equity in terms of distribution and others. Now, I wanted to mention that really we're talking about a pandemic that has been really, the world has not been prepared to, and the MENA region is no exception. Now, what I wanted to mention that so I know that there's a lot of debate now about vaccines and readiness, but I want to mention that really there is a lot of areas within the public health system that we need to actually maybe put more light on this. And one of the things that I think policy consideration that we have to keep in mind, particularly now that we're talking about vaccination, you would see that a lot of debates now changing from how to respond to COVID-19 and now how to really address vaccination. But we've seen many public health systems, including in the region, issues about planning, coordination, regulation. I think it's very important. The issue about the chain management, capacity of the workforce, human resources, funding, and how we can really support resources, particularly high income, low income, health literacy. We've signed a major issue, by the way, and this is something that we can discuss more. Surveillance. So what I'm trying to say, there are really fundamental challenges that public health system in the region was challenged about. Now, the other thing I want to mention also so the first part that yes, many public health systems in the region were not prepared as any other countries. Some countries are really trying to address some of the inefficiencies and deficiencies by doing a swift response and policies and regulation. Other countries are being challenged by limited resources. But I want to mention really that the issue about the race, which is a global race, when it comes to vaccine and how we are looking at vaccine nationalism. I think this is very challenging in MENA countries. Many of the MENA countries are low middle income countries. They have some challenges. I mean, the Gulf countries aside, but there is really an issue related to the nationalistic approach to look at this. Besides, we're given that there is a lot of political element to that. The issue about vaccine diplomacy, we're starting to see that in our system, and what that means as well to health system capacity, which country is providing vaccine to which country, what are the facilities are really provided. We started last year by mass diplomacy. Now we're seeing vaccine diplomacy. China's efforts in terms of to frame itself as a solution. That's why maybe again doing some arrangement with some of the countries that are having some good political relationship with, in addition to other Western countries. So what that means to the region, we're seeing that many of the countries, and I'll give you a lot of examples in Bahrain, in Egypt, in Saudi Arabia and Kuwait, many of them, they already started. So they already started the vaccination, despite many of the challenges that they have in the health system. Some other countries are really late. Even in Lebanon, we still haven't received even vaccines. Morocco still hasn't received vaccine. Sudan still haven't received vaccine. Same thing in Syria, same thing in Tunisia. You see there's really quite challenges, and not to say about the type of vaccines ordered. So the type of vaccine ordered can tell you, something about vaccine diplomacy and how Western countries are using it in order to actually provide it. So I want to mention one thing about, the equity part. We have an issue about coverage and equity. And you will see, if you see wealthy nation, in fact, representing 13% of the world population, have so far already cornered more than 51% of the promised doses of COVID-19 vaccine, more than 51%. So which means that this is really creating huge inequities. Now, I know WHO and COVAX and Gavi is really trying to address that in terms of risk pooling and risk sharing, but this is very important. The other thing I want to mention about MENA, many MENA countries, they have challenges when it comes to vaccine deployment, whether it's really about the resources that are really there, lack of transparency and communication, health illiteracy. Even many people still know that do we need to take vaccine or not? Is it really beneficial? Is it risky? There is a lot of awareness needs to be related to that. And the out-of-pocket payment for that, because vaccine is a public good, but I can tell you the black market already starting to happen in some of the low middle income countries. So I wanted just to mention that there are several challenges when it comes to public health systems. In addition, what would it take now that governments start paying attention to some of the pressing priorities and diseases beyond COVID-19? What's happening now with this crisis in the Middle East? Most of countries have diverted political and financial attention from other health priorities. And this is a region that is really a significant burden of disease when it comes to non-communicable diseases and others. And my worry as well, and this is one of the hidden challenges in public health, that also there's really some health priorities and diseases that are not being really provided the support required despite the pandemic. So inequity, a public health infrastructure that is really quite weak, health system that is really quite challenged, a lot of inefficiencies, but at the same time, a lot of focusing on nationalism when it comes to solutions, less solidarity, less cooperation to a certain extent, and more inequities.
Thank you, Fadi. That was very broad and extensive. I guess my one quick question before we move on is, what is the role of state and non-state actors in vaccine rollout? and maybe a brief example in relation to maybe Lebanon. But I realize the time is quite short, so if you can condense it into maybe 1 minute, that would be awesome.
Yeah. So I wanted to say this is a very important question about the state and non-state actors. In many countries in the MENA region, particularly low and middle income countries, the state is weak. It's fragile, and the governance is weak, which means that the non-state actors, including the private sectors, has a very important role to play. Now, what we've seen from this crisis that unfortunately many of the private sector, they are still seeking profit out of this. And that's why you see many private hospitals, even in Lebanon, not accepting even yet COVID-19 patients, although they have capacity. So we've seen that instead of having a public-private partnership, whether in terms of addressing COVID-19 response and also in terms of vaccination, we're seeing only contractual arrangement between state and non-state actors. And this worries me because this is where it creates as well a lot of inequities and inefficiencies. And I think the pandemic, give us one important lesson that states in the MENA region has to rethink the arrangement when it comes to engaging non-state actors, including the private sector and the non-governmental organization, how they can be real partners in addressing national crises like COVID-19.
Thank you very much. Thank you for that. We're going to come back to vaccine rollout. For now, we have Tamam Aloudat, who is a doctor and public health practitioner from Syria, who is currently working with Doctors Without Borders on its MSF Access campaign, which is making life-saving medicines and vaccines available and affordable for people in low resource and crisis situations. He has extensive experience dealing with illnesses in conflict areas. So I guess my question here is, why is there an issue with access to medicines, and how does it apply to vaccines? And maybe if you can also talk about refugees and access to the vaccines in relation to refugees, for example, in various parts of MENA, that would be great. Thank you.
Thank you very much. Thank you for having me and for giving us the opportunity to discuss vaccines in the region. Let me start by just framing things a little bit. What we do in MSF Access campaign is we argue that medicines that are life-saving and essential shouldn't be impossible to access by most of the population of the world. And that is in low and middle income countries or marginalized populations, even in high income countries. And we've done that with HIV/AIDS, with drug-resistant tuberculosis, malaria, hepatitis E and C, and a host of other diseases. And with many vaccines, including pneumococcal vaccine, and as is known, pneumonia is still one of the biggest killer of children in the world. So that experience will allow me to frame things in a way. This pandemic has received a massive amount of attention globally by the media, by everybody. Reservedly, it is a huge crisis, but almost nothing of the problems that we are facing with this pandemic or with the issues with the access to medicines is entirely new or even remotely new. Issues like, Professor Fadi talked very aptly about the world not being prepared, but also about vaccine nationalism and about the health infrastructures not being capable of addressing a disease of this sort. Now, vaccine nationalism and the exclusivity, whether through pricing or availability or monopolies on medicines, has happened and continues to happen with many medicines and vaccines, and is rarely addressed as vigorously as it is now. And I would argue that the reason we struggle to talk about drug-resistant TB medicines while we get asked to talk about COVID vaccine is particularly because when Western countries, rich countries, are affected by COVID-19 and are not affected by the other diseases. So they start becoming upset and angry. And I'll quote something before I start answering the question from the front page of the CNN, where AstraZeneca has gone back on their promise to sort of supply the European Union as fast as they desired. And the commissioner, the health commissioner of the EU, indignantly says, we are in a pandemic. We lose people every day. Those are not numbers. They are not statistics. These are persons with families, with friends and colleagues. And that is absolutely right. And I wish they had the same things to say when outbreaks happen in poorer countries and have the same eagerness to achieve access and availability of the drugs and vaccines. Now, going back to this, the world is not prepared, and I agree with Professor Fadi, absolutely. And it's not unprepared because of the unpredictability of the pandemic. The pandemic is absolutely predictable. We've seen the H1N1 in 2009. Since 2005, there was an H5N1. Admittedly, both are influenza outbreaks, but there has been extensive work on pandemic preparedness for the past 15 years. To reach this stage and be this unprepared is mind-boggling. That aside, there are a few things that are specific. Most of the vaccines that are available now or becoming available now have benefited from massive amounts of public funding. They have been paid for by taxpayers, at least a large part of the cost of development. And yet, we are facing a situation where we have to beg and plead with pharmaceutical companies to make their vaccines available at reasonable prices. We are asking them to make it available at cost, so the price of the vaccine doesn't become a barrier for its access. However, only a couple of companies promised that, and even those who promised it do not give us information about their cost of production or about licensing and sub-licensing agreements, so we'd actually be able to judge. And even the companies that have boasted a lot about paying for no profit have given themselves an agreement, like AstraZeneca, the power to declare the pandemic finished by July 2021. So they confine themselves to selling at price for the duration of the pandemic, but guarantee that they can finish it regardless to what happens in the real world. But on the other hand, Pfizer and Moderna have made no commitment for reduced prices or selling at cost, which is one of the things. The other is obviously transparency. The third is sub-licensing. We cannot expect the limited amount of production capacity that is available for those companies to cover the whole world. Hence, of the 9 billion doses or so needed, there will be a fraction available by the end of the year. And that's if we're optimistic, because as of yesterday, AstraZeneca is unable to even fulfill the demand of the European Union. So we're not even talking about the MENA or about Latin America or about Southeast Asia or Sub-Saharan Africa. We're talking EU cannot get enough doses. And yet we cannot ask companies to make the knowledge, the know-how and the technical capacity available freely for other institutions to be able to produce the vaccines. Now, all that aside, I think there are a couple of issues, before I overtake my time, there are a couple of issues that are important to judge that are related to the MENA region specifically. And we have different circumstances. In our region, we have a double burden of disease. We have a lot of infections, hence child mortality and morbidity, and weak health systems in especially the lowest or emergency affected areas. But we also have the lifestyle diseases and the chronic conditions that have been quite invasive. Unlike Europe, life expectancy of people who die of heart disease or lung disease isn't 85, it hovers around 65, so people die much earlier, which means we have a higher population who have what is called, pre-existing conditions, which increases their risk for the COVID. We also have large populations affected by emergencies, and those were mentioned: Libya, Syria, Iraq, Yemen, and others. But you also have countries that have been affected secondarily by those emergencies, where You have the large number of Syrian refugees in Lebanon and Jordan. You have Sudan and places that are affected by chronic underdevelopment, malnutrition, and poverty. So that takes a toll on the health system. And those health systems can scarcely be expected to cope with a massive vaccination campaign with a vaccine they don't know across fighting lines and crisis lines and with populations that might, and I would say, not unjustifiably have other concerns. If people can't eat and can't protect themselves from bombs and bullets, you can hardly threaten them with the, tortures of the pandemic. So there is a set of circumstances that makes it very difficult. Now that adds to that is the logistical difficulties with the vaccine. And some of the vaccines can be retained and distributed at normal temperatures, but others can't. And especially the mRNA vaccines, the Pfizer and Moderna vaccines require hypercooling, which is going to be difficult in the richest countries to retain the hypercooling up to the peripheral level where the vaccines are. And it's nearly impossible anywhere else. So there's a real logistical challenge, and that disfavors countries that do not have the resources to sustain it. I will mention a couple of things. One is that there is that was mentioned that Gavi, the Global Alliance for Vaccines and Immunizations, has created the COVAX facility, which is supposed to avail 2 billion doses by the end of 2021. This is massively optimistic. And there is plenty of discussion about whether COVAX will at all be able to do that. And that worries us. The other one is about what is called the humanitarian buffer. So there's supposed to be 2 billion doses. No, sorry, a different number. I'm not entirely sure the number now. That of doses available for humanitarian settings, there's not yet a mechanism that allows an impartial distribution for those according to need. I'll stop here. I'll be happy to answer any questions you might have later. Thank you.
Thank you very much. There's certainly, so many challenges in terms of inequality across the board. Which we will get back to talk about that in just a moment. So finally, we have Dr. Yara Assi, who is a postdoctoral scholar at the University of Central Florida and is a US Fulbright Scholar to the West Bank. Her research agenda focuses on global health and development in fragile and conflict-affected populations, and she has presented at multiple national and international security, general health, and women in healthcare. Dr. Yara, with your regional focus, how pandemic, given a pre-existing healthcare system that's been depleted by decades of occupation, and also how has Israel made it hard for Palestinians to respond to the pandemic, including...
Are we all frozen, or is...
I think we, same here.
Since we're live, how about Yara, you start answering while Narjas manages to come back.
Yes, hopefully she comes back soon. Yeah, so I think I understand the gist of her question, specifically about vaccinations in the Palestinian territories and Israel's responsibility to do so. So thank you to Narjas and to the
Sorry about that. I don't know how much you got. My internet broke up.
Oh, it's okay. It's
so
okay.
Sorry.
I'll just
did you get my questions?
Yes, I did.
Yes. Okay. Please continue.
So I think Palestine makes a really great case study to examine in detail some of the issues that my colleagues have been discussing, more broadly across the region. So for your viewers who are a little less familiar with the on-the-ground reality there, I thought I would start by discussing the basics of the Palestinian health system prior to COVID-19, because I think it provides some really important context. So after decades of occupation by first the Ottomans, then the British, Jordan, Egypt, and then now Israel, starting in 1967, there really was no formal health system in the Palestinian territories. With the Oslo Accords in the mid-1990s, the Palestinian Authority was established, and with it, the Palestinian Ministry of Health. So it's quite a young agency. Along with this agency, you have other health providers for Palestinians, such as the private sector for Palestinians who can afford it, UNRWA for registered refugees, and NGOs that provide various services to usually distinct populations. So it's a very fragmented health system in general. So there's large areas of overlap, and then there's large gaps in coverage, especially for poor Palestinians, those living in rural parts of the West Bank, and essentially for all in the Gaza Strip. So while health indicators have increased in the past several decades, as we've seen across, less developed countries, the Palestinian Authority has been successful in some public health efforts, like basic vaccinations. But every analysis of this health system emphasizes the significant barriers posed by blockade and occupation. So it's important to emphasize here that Palestine is not a state. It was recognized as a non-member observer state by the UN in 2012. This is the same status afforded to the Vatican. It does not have control of its borders. It does not have an autonomous government. And the Palestinians are subject to Israeli movement restrictions on all goods and people. Even travel within the West Bank is tightly monitored and constricted, checkpoints, the separation wall, the settlement infrastructure, etc. So nothing, not even medical supplies, enters the West Bank or Gaza Strip without approval from and coordination with Israel. At the beginning of the pandemic, this was even true for ventilators and testing kits that were being donated by humanitarian actors. Palestinians are not permitted to build an airport, so they cannot import medical goods or the vaccine directly. And with budget shortfalls and electricity cuts, they don't have the cold storage facilities we were just talking about that are needed to store these very delicate vaccines, I think with the exception of maybe one facility in Jericho. The largest component of the PA, the Palestinian Authority's budget, which is of course very dependent on foreign aid, is security coordination with Israel, and more than double the amount that is set aside for public health. So I say this to make clear that these issues have existed for as long as most Palestinians have been alive. And so when COVID-19 entered the picture, no one should have been surprised by the outcomes we've seen. So despite statements by some Israeli ministers and legal scholars, it's also important to note that almost every international body and state, including Israel's own Supreme Court, continues to recognize that the West Bank and Gaza Strip are occupied by Israel. So this brings us into, of course, the Fourth Geneva Convention, which mandates responsibilities of an occupying power towards an occupied population. And these are broad obligations and burdensome obligations because, right, military occupation is not supposed to last 50, 60 years. This includes specific provisions for public health, hygiene, medical supplies, and these duties are not displaced by humanitarian aid, and no agreement between the occupied and the occupying power removes these protections. So the main justification I hear about that the PA should be fully responsible for this is, of course, the Oslo Accords, one of these agreements. Often they're referring to Article 17, which regards health, which states quite broadly that powers and responsibilities of health will be transferred to the Palestinian side, and that the Palestinian side will apply the present standard of vaccination to Palestinians, which they have done. Yet even if one were to assume the faulty premise, in my opinion, and the opinion of many legal scholars, that the Oslo Accords does supersede the Geneva Conventions, examination of the Oslo Accords itself and the specifics refers one to a routine vaccination chart that includes hepatitis B, DPT, polio, MMR, other basic vaccines afforded to almost all children across the world. With regard to pandemics and epidemics, specifically the two parties must coordinate. And further, of course, politically, it's important to note that the Oslo Accords, again, signed in the mid-1990s, was meant to be part of an interim agreement that would lead to a political settlement within 5 years. And this has admittedly not occurred, I think, to say the least. Another justification offered for the lack of Israeli coordination is that the PA didn't ask. So I find this interesting for a few reasons. One, I can't think of any other legal obligation that is dependent on the non-dominant party asking for compliance. And two, we all knew in April of last year, of 2020, that we would need a vaccine to get out of this lockdown cycle. So coordination efforts between Israel and the PA should have started then. If Israel had offered in earnest to work with the PA and the PA rejected this, then the PA should be criticized. Indeed, conflicting statements and press releases from the Palestinian Authority, various members, has painted a really confusing picture to global audiences. So just as Israel does not get to pick and choose its legal obligations, nor does the PA. The PA's existence is justified by the Oslo Accord. So that puts it in a strange position in wanting to both posture as a functional government, but under a reality where they don't have the funds, power, or control over their state to actually serve as one. And let's also remember that Palestinians have not voted for their leadership in nearly 15 years. And public polls have shown for many years that Palestinians are not happy with their leadership. So the lack of any positive change in this conflict since Oslo makes clear, why this is the case. So now with the specifics of COVID, Israel is reporting that it's vaccinated nearly 30% of its population. This far outpaces any other country on earth, including the UK, Germany, France, the US, across the board. And in fact, they're moving to vaccinate 16 to 18-year-olds now to allow them to return for school for exams. Meanwhile, the latest reporting that I've seen, and this may have changed, indicates that Palestinians have only received 100 doses total so far. They're waiting for a donation from Russia from its vaccine. And they've worked out deals with other pharmaceutical companies and through the COVAX program that we just heard. But a week ago, the Palestinian Minister of Health said she hoped the vaccines would arrive, quote, in the first quarter of the year. So no real date on when the vaccines are coming. And the COVAX shipments are not expected to arrive until mid-year. So that would put us in the summer. So this is in the context of more than 176,000 cases and nearly 2,000 deaths throughout the Palestinian territories. The World Bank estimates that the Palestinian GDP could dip by up to 35% as a result of this virus. Health officials throughout the Gaza Strip and the West Bank have been warning of imminent collapse, overwhelm, burnout, and overwhelmed facilities for months. So, an additional month, 2 months, 6 months of waiting for a vaccine, this is not an abstract issue. This could bring the Palestinians to a situation that will be extremely difficult to recover from, to say the least, especially because you consider the typical donors who buoy the Palestinian Authority, they're also under tremendous financial pressure domestically, and there's many global funding priorities right now. Every low-income country needs help. It's not a focus on any one. Thus far, the United Nations, Amnesty International, Human Rights Watch, progressive and liberal politicians throughout the US and the UK, and human rights groups within Palestine and Israel have called on Israel to start vaccination efforts with Palestinians. And this is in Israel's best interest as well, if we're being pragmatic. Aside from the Israeli settlers and soldiers that are throughout the West Bank stationed living there, hundreds of thousands of Palestinians enter Israel every day to work as day laborers, primarily in the construction sector. In fact, some of the first cases in the West Bank were associated with those who crossed the border into Israel. There's no disconnecting the populations, and COVID-19 does not care about one's legal status. So I will end there and leave room for questions, but hopefully I covered most of the topics. So thank you so much.
Yes, thank you so much for that incredible answer. So we're going to open it up to questions, and I've got a few here already. I guess the first question is directed at Professor Fadi. What are some of the policy considerations for vaccine rollout? And also, can you also mention, you've all touched on delivery challenges a little bit, but if you can maybe give concrete examples, concrete country examples of delivery challenges related to the vaccine rollout. And if at any time Yara or Tamam, you have something to say, by all means, you can interject, just unmute yourself. And we can really get like a nice discussion going, I guess. But yeah.
Sure. So thank you. So let me just quickly just mention before I go to the question, if you allow me. And I think based on what I think from these three interventions, I just wanted to mention that I think we're witnessing more of a moral failure at the global governance when it comes to health and public health. And we've seen it at different level. I think Dr. Tamam mentioned very clearly in terms of pharmaceutical companies, the whole model of research and development even failed the R&D system, how we do that, how we fund pharma pharma. Even if you look at SARS and MERS before, even Ebola and Zika and the vaccine that stopped later on because there was no demand. I mean, the SARS and MERS, and the argument that if we continue at that time to invest in 2015, 2016, would have been at a better stage of actually being ready for a better vaccine. I mean, so the model, the pharma model, also there is a failure at the level, exactly what Dr. Yara mentioned when it comes to, as I mentioned, the vaccine nationalism, how we're thinking about it, and how we are really, it's in the issue about equity and access and discrimination, I would say, is really very clear. So I wanted to mention there is a moral failure, and at the level of international organization, whether UN institution and other, they have really a certain challenge of actually bringing everybody when it comes to global solidarity around that. Now, when you go to the question about the policy consideration, I think the policy consideration differs whether this is really a high income country and a low income country. I think this is we have to do. But if we want to go into the details, and I tell you, one of what we have seen, for example, the case of Lebanon, that in fact Lebanon was not ready even to sign with Pfizer. There was no legislation or law that in fact addressed liability, and Pfizer put it as a condition: we will not send vaccine to Lebanon up until we have a legislation or law that actually more address the issue about liability, which means that the government of Lebanon should take responsibility for any side effects that will come from vaccine that at some point at the level of experimental vaccine, particularly at the level of phasing. So that's the issue about legislation. The issue about how we will actually address and who's gonna get vaccinated first or not, and the criteria is being used. I tell you, there is some differences across countries related to that. The issue about storage capacities in the country when it comes to Pfizer, how much how much in terms of storage, in terms of temperature versus Moderna versus other type of vaccine. This is also an issue. The issue about who's going to actually oversee the whole deployment process in a country that is really quite weak in terms of infrastructure. What is the fate of the remaining population that is not part of the phase 1 vaccination? How are we going to address vulnerable people, underserved areas, refugees? This is also a big issue about it. How are we going to protect the public from the black market and the side deals? So there's a lot of policy consideration. I think the issue here is that how we want to have to make sure that we have a good political leadership at the global level and at the country level to counter the issue about vaccine nationalism, but at the same time to make sure that we have fair, equitable distribution and deployment of vaccines and reaching out to those people that are really required to be vaccinated. I mean, we mentioned, Dr. Yara mentioned about Israel and the percentage, how much we have in terms of vaccination. And in fact, if you look at who are they vaccinating, they are vaccinating even age group that is not a priority now to be vaccinated. And this is very important. At the same time, the trade-off that there are other vulnerable people at certain age group that have chronic diseases, that are elderly, they are supposed to be given the priority in comparison. So there's a big trade-off here, and this is the issue about equity and inequity, and that's why I'm saying we have a moral failure, ethical failure.
Thank you, Fadi. We've got another question here for Yara. Can wealthy Arab states or UN organizations do more to bring the vaccine to Palestinians?
I suppose the answer is yes, but we have to remember, nationalism is real, and so they're going to prioritize their own citizens. And B, I know the PA has been reaching out to all its usual donors and, the infrastructure that has supported them in the past. But regardless, everything, again, that enters Palestinian land must be coordinated with and approved by Israel. So even these efforts where the PA is trying to exercise some autonomy, even in receiving donations, they ultimately don't have the final say. And then the logistic issues that you bring up, will not be, these are issues that needed to be addressed decades ago. How do you get to rural villages in the West Bank? How do you get the approvals to enter the Gaza Strip? The Gaza Strip has no cold storage facilities. So what, do we have to bring in vaccines and do mass distribution the same day? Getting the vaccine in the country is one problem, but then you have the existing public health infrastructure, and unfortunately there's nothing these external states can do except for push for an end, a just political resolution to this conflict, and that won't happen in time for adequate distribution, unfortunately.
Thank you for that. I have one question for Tamam, and I guess this kind of feeds into what Yara was saying about maybe the role of the UN, but also what would you say is the role, if any, of humanitarian agencies in vaccine rollout in relation to things like the humanitarian buffer for vaccines? If you can talk about that in relation to particular countries in the MENA region, that would be really good.
Yes, thank you. There are many inaccessible populations affected by emergencies in the MENA region. So, and here let's just mention something clearly. Of course, there known and acknowledged humanitarian actors are usually UN agencies and large international NGOs. In the MENA region, we have seen over the past decade now many national and local NGOs or groups or entities that have provided a large part of the humanitarian and medical action, especially in the most conflict-affected areas. So if it wasn't for them, the access by international humanitarian agencies is severely restricted. The other thing is about displacement. And of course, we talk about the refugees because we understand the numbers of the refugees, and they are spoken about quite vigorously because they are in other countries. However, we know quite well that the health circumstances of internally displaced populations in conflict settings is much worse in the best of days, no pandemic included. So mortality goes up to 3 times in internally displaced populations than it is in, and those are systematic reviews of across the globe with multiple emergencies, and those are hardly mentioned. And this corresponds to the whole situation in this pandemic, where the more vulnerable populations are, the least they are mentioned and considered. So that being the case, humanitarian organizations have a very difficult time being able to actually be a provider of vaccination because of the scarcity of the vaccine and because the bidding wars that are happening between countries doesn't make it very possible for it's not a market that is open where vaccines can be bought and taken. And second, in an emergency this size, it's not really open to the argument of let everybody do whatever they want. There is a level of coordination by governments that has to be assumed and followed. So even if we have in MSF chosen multiple times in the past to intervene in specific populations affected by emergencies with specific interventions, that doesn't exactly apply here. Neither the logistical circumstances, nor the specific needs, nor the moral or humanitarian prerogative allow us to overcome, brush aside the greater coordination. However, what we're asking for is that the COVAX facility and the humanitarian buffer are available in a way that achieves a level of equity. And secondly, that we do not just dilute ourselves by saying that the humanitarian buffer is going to be a solution. It is one of the possible solutions, but the humanitarian buffer isn't going to be enough vaccines. Neither will it guarantee an infrastructure that allows effective implementation. And here comes back to the, in the end of the day, there's a moral failure. Yes, absolutely. However, a moral failure almost implicitly says that there was a moral desire to succeed. And that can be argued quite vigorously, because I don't think when in Arabic we say when the water reached their knees, none of the Western powers appeared or acted in a way that tells us that they are interested in protecting the lives and availability for poor countries. And all the rhetoric aside, of course, they came up with this global public good argument, which is interesting and may come from a good place, but it's very difficult to argue and prove. It's a very specific economic concept that doesn't exactly apply here. And we're sitting and arguing about semantics when vaccine is actually not reaching. When we have a possible solution that is legally possible, logistically possible, like a waiver that was demanded by India and South Africa on the intellectual property of vaccines and medicines related to COVID-19, it is vigorously opposed, mostly by rich countries who care more, who appear to care more about protecting the profit of their companies than they are about protecting lives in poor countries. So it's a moral failure, it's a logistical difficulty, it's a pandemic, it's never going to be easy to handle. But what has started as a promise of, the pandemic was called an equalizer in the early days. It has proven to deepen all the inequities and all the oppressions and difficulties faced by many poor populations. Finally, I will say one thing. We might see or might not see an overcoming of that moral failure. We might see a production that guarantees some coverage for populations, especially populations that we serve as MSF in Yemen and Syria and Iraq and Libya and Jordan, and Lebanon, and so on. And I will just re-emphasize here, that doesn't take away from the fact that there are health issues that are unaddressed. There are fragile health systems that are unsupported, and that those all will have been amplified massively inside this pandemic. We don't even know how much, because the numbers because no one is paying attention enough to other health issues. We have had a cholera outbreak in Yemen just a year ago. We've had multiple outbreaks of other diseases and peaks in infections and mortality in other Arab countries, especially those affected by emergencies. And we will have to reckon with all that quite soon. And we will act surprised then, which is unjustified. Thank you.
Thank you. We've got another question here. This one is for Professor Fadi. Could the new administration in the US move things in a different direction globally with the return to the World Health Organization and maybe COVAX as well?
Well, certainly, with the new administration, what we have seen so far since last week, there's really quite a radical, dramatic type of policy making or policy decisions that are being made since inauguration. So we're happy to see that. We're happy that the U.S. is going back and working with WHO. We're seeing many of those decisions, unfortunately, ill-informed decisions, I would say, that were done during the Trump administration are being reversed at this stage. So, but I think it's too early to know whether this will have really quite a positive impact at the time of crisis. At the time of crisis, I think one of the, you need to actually bring all the efforts together. You need to support, and you need to have global solidarity, something that we haven't seen so far. So it's really too early to judge whether the new administration will be able to. I think the new administration has a lot of challenges now internally within the US, because the whole COVID crisis was mismanaged. In fact, there was a lot of infodemic, there was a lot of manipulation of facts. And it's interesting that, coming from President Biden in the inauguration speech, when he said that we will give power to the science and we will actually give power to the facts, and we will not accept manipulated facts from now on when it comes to dealing with health and addressing COVID-19. So it seems to me the priority for the U.S. administration now is actually internally within the U.S. But certainly I'm very optimistic, and some of the decisions that have been made, since last week, is quite promising. But it's too early to actually to see the result of that.
Thank you very much. We've got one question for Yara. Is Gaza and West Bank coordinating more on health despite the political schism?
Well, you know, it's so in recent weeks they've been announcing some forms of reconciliation ahead of some very abruptly announced elections, which we'll see how that goes. What's interesting is that in a lot of the the Palestinian Authority's statements, there's very little mention of Gaza or coordination with Hamas, which is the governing body of the Gaza Strip. Even with the Russian donation of their vaccine, while there were certain permissions that had to be approved to get it into the West Bank, even higher approval from the Israeli Prime Minister's office is needed to get those into the Gaza Strip. So, the PA has very, very little role in that. The PA is struggling in its own territory. I hope that there's some form of political reconciliation. But again, when you have these decades of political problems, they are not going to be fixed in days or weeks in time for, the pandemic is happening. It's been happening for 10 months. So again, without a political settlement, a political resolution to the entirety of the conflict, the PA is admittedly very limited in what it can do in Gaza. I'm sure, there's always behind the scenes negotiations between the three parties, the PA, Israel, and Gaza, that are not made public because we see the outcomes of them, especially when there's active conflict. But public statements have still made the two territories seem quite separate, which is really worrying for the Gaza Strip. Because they are, 50% unemployment, very high poverty, very high food insecurity, again, with all the vaccine distribution issues. And the PA is just not the authority that is able to manage or handle those crises.
Thank you. There's a question here for Tamam. Are Russian-Chinese vaccines an alternative in the region? And also maybe touch on kind of vaccine diplomacy examples and the challenges related to that as well.
So are they an alternative? You have two issues to this question. One of them is, are they effective? Do they work? And the other is, are they available? Can they be brought in? And for the first one, there are trials that are ongoing on the later stages on all vaccines. None of the trials is conclusive. And just to be clear, none of the existing vaccines, American, German, British, or Russian, would have been approved has there been no pandemic. They are all approved on exceptional emergency basis for use in pandemics, which is a normal process. It's nothing to scoff at, and there's a lot of data on them. There is a lot of politically motivated rhetoric on all sides. If you read the news that, in Arabic, and funny enough, in Arabic, we have a lot of news that affiliate or empathize with different sides of the global geopolitics. You'd have different opinions depending on which websites you read. There are trials that are, all of them do not provide data that is publicly available and completely transparent. So what I would say is I don't know that any of them is worse than any of the others, and hence scientifically having a vaccine that is undergoing trials, that there is some publication, some sharing of data, is almost certainly better than not having a vaccine. Now, are they available? Can be made? Can they be? And there is plenty that is happening. To my understanding, for example, the UAE and Bahrain are providing Sinovacs, and Bahrain has actually, the United Arab Emirates has mentioned manufacturing it nationally with sub-license from the Chinese company. So yes, there is a movement towards providing them. There are some confusions because, like most countries, governments are buying the vaccines that are available, so there's not necessarily a consistency per country of what vaccine is available. And in some cases, my understanding is people get to almost choose whether they want the Pfizer or the Sinovac or so on. So That's difficult. It's hard to expect people to know what to choose in a situation like this. I wouldn't know what to choose. I'd rather have a consistent policy by a government that has all the data they have. Now, are they available? To some extent, yes. All of them are subject to manufacturing, to logistics, but also the desires of the companies and
sorry, I'm
governments.
just going to jump in and give you a
Yes.
time. You
Yes.
can for the next
So
20 seconds.
sorry, this is a very difficult to answer question because there's nothing certain about it. I think my bottom line is when people can be vaccinated, they should be vaccinated. The vaccine hesitancy and the rumors of the facts or fake facts and all that are going to be a risk for hesitancy that is unnecessary and potentially dangerous. Sorry for my babbling.
No, not at all. It's I could.
No worries. I do that.
A lot of time. No, it's fine. We've got 2 more questions, so I'm just going to ask both of them and then leave the answers to you guys. The first one is for Professor Fadi. So Lebanon's healthcare systems have been particularly challenged due to several unrelated emergencies, including COVID. And so the question here is, what are some of the pressures that the government face in Lebanon? And then Yara, there is a question here about Palestinian refugees outside of Palestine and how they're being looked after. So maybe if we go with Professor Fadi first and then Yara.
Yeah. So unfortunately, Lebanon was hit hard by so many different crises, not only by COVID-19, with the Beirut explosion, with the devaluation of the currency, with the economic and the political instability. A lot, unfortunately, of challenges was crippled, in fact, the government of Lebanon. And as we know, Lebanon is a weak state when it comes to governance, and there's a predominance of the private sector. So some of the challenges that we have is that we have poor infrastructure and the public health system. A limited investment done over the last many years. And I think they made the wrong political choice of not investing in public hospitals. And we have, in fact, more than 80% of the beds hospital beds in Lebanon is really private sector. The challenge that government is facing is that, how to engage in a effective way with the private sector. Private sector has been seeking profit for many years, and they are not really in a quite clear at the same level when it comes to partnering with government to address the crisis. So this is really one of the challenge. Second challenge is the poor capacity and the limited number of beds. The third, unfortunately, the issue about health literacy or illiteracy and the poor compliance of people when it comes to lockdown and strict measures. That's why we're seeing significant surges. So the challenge really how we can get from this political and economic challenge that we have to have a country that have the real leadership in order to address critical, urgent issues when it comes to access and capacity and responsiveness. That's a challenge that we're living in day by day.
Thank you, Professor Fadi.
And I'll keep my answer very short. To my knowledge, no Palestinian refugee has received the vaccine yet. We know Jordan is the first country to have started vaccinating refugees. In general, Jordan, of Lebanon, Syria, and the surrounding countries where Palestinian refugees are, generally treats them better, has given them citizenship. In general, they're treated quite poorly. They're stateless in Lebanon. The camps are very overcrowded, low water, low hygiene, very hard to social distance. So I believe the first refugees that Jordan vaccinated were from Iraq. So, the refugee question, I think we could have a whole other webinar about who's going to assume responsibility for vaccinating refugees. But from my knowledge, no Palestinian refugees yet.
Thank you, Yara. We've got, one more question. I'm going to squeeze it in. Professor Fadi, are civil society organizations doing anything about the challenges you spoke of before in Lebanon?
Yeah, this is one of the major sectors that unfortunately there is a lot of untapped potential. I think the key that we've learned from this crisis of how we can unlock the potential of the civil society groups. Civil society and the non-governmental organization playing an extremely important role in terms of trying to address some of the unmet services or address some of the deficiencies and dysfunction the state has. The challenge that many of them are ill-resourced, ill-equipped. They depend on soft money. and they are not really part and an important player in the health system and the public health system arrangement. Something that we need to keep in mind in Lebanon in terms of strategic vision, that the COVID-19 help us realize that the state cannot meet all the needs of people. How we can tap into the potential of private sector, civil society groups, NGOs, and others in order to bring them together and make more of a coordinated partnership that can address all the required services and needs for people. Unfortunately, a huge potential for our NGOs and civil society groups, but we need even to better support them and equip them and make them part and parcel of the arrangement.
Very quick and condensed answer. You still answered it wonderfully. This is the end of our webinar. It's been incredible listening to everyone talk about the kind of monumental challenges faced by not only the world but the MENA region, and how different countries will attempt to sort out, I guess, all of the health issues related to COVID. Thank you so much for coming onto Zoom. It's been great, and hopefully we will reconvene at some point in the near future where we can hopefully talk about something to do with positive vaccine rollout in the coming months. It's been great. I will see you soon. Thank you very much.
Thank you for having us.
Thank you very much for having me.
Bye, everyone.